A really good question is when, if ever, is it too late to start hormone replacement therapy? This is a super important question because 2 decades of women were ignored when they went into menopause and were not really offered hormone replacement therapy because at the time, the doctors that were following the algorithms didn't offer it to them because of the risks. Last week, I had a woman come into my office, 63 years old, struggling with brain fog, fatigue, not sleeping well, unable to be intimate with her husband because of pain. And when I asked her if she ever took hormone replacement therapy, she just kind of looked at me and said, no one offered it. And now it's too late, is what she said. My gynecologist told me that it's too late for me to start. This video is to talk about that. What does that mean? Where did that come from that you shouldn't start hormone replacement therapy or that it's too late? We're finally talking about hormones. The Women's Health Initiative was 23 years ago. 24 years ago was when the information came out. Just recently, the FDA removed the black box warning against hormone replacement therapy for causing cancer. And now we're starting to have the conversation. But what do we do with those women who haven't been offered hormone replacement therapy for the last 24 years? I'm Dr. Yvonne Karney. I'm the hormone locksmith. I'm an OBGYN, traditionally trained, practicing for 25 plus years. And for the last 10 years, I've been doing it differently in functional medicine. And I'm going to give you my viewpoint on this today. So where did this start? Early in my training, we gave hormone replacement therapy to everyone. We thought it was so beneficial. I'm talking about the late 1990s. Everything changed in 2002. In July 2002, the Women's Health Initiative, they discovered that women who were on the hormone replacement therapy arm had a slightly higher incidence of breast cancer. And so the study was halted. Women all over the world stopped taking their hormones, and doctors stopped prescribing hormones out of the first do no harm principle. And I agree with that. If we really think something is harmful, we wouldn't prescribe it. That's the date that everything changed. Before 2002, approximately 35% to 40% of women who were eligible for hormone replacement therapy were on hormone replacement therapy. That number plummeted late 2002. By 2005 to 2009, only 5 to 7% of women who were eligible by criteria, menopausal, for hormone replacement therapy were taking it. A huge decrease. A lot of those women suffered for years. In 2020, the FDA estimated that 41 million Americans were menopausal, and yet only 2 million hormone replacement therapy prescriptions were written. In the last year or two, there's been a resurgence and more women are demanding hormone replacement therapy and switching doctors if their doctor wouldn't give it to them. And then recently, thank God, the FDA relooked at it and realized that the data didn't show that hormone replacement therapy was dangerous. Dr. McCary, the leader of the FDA, said that it was one of the biggest mistakes in modern medicine in the last 25 years. That's a big admission. However, even now in early 2026, the data showed that only about 1 in 20 women who were in the 45 to 55 age group window had a prescription for hormone replacement therapy. Let's go back, though, for a minute and talk about what the Women's Health Initiative actually was. It was designed as a prospective cohort study, which means you follow women over time and see what happens to them in their health. And there was a hormone replacement therapy arm and a non-hormone replacement therapy arm. The aim of the study was actually to determine if hormone replacement therapy decreased heart disease risk. Had nothing to do with breast cancer. So they were evaluating heart attack and major cardiac events is what they called it. And we're trying to determine if hormone replacement therapy would decrease chances of having a major cardiac event. One of the big issues with the study was that the average age of women was 63 years old. That's a decade past the average age of menopause. The participants in the study ranged from age 50 to 79 years old. So why does that matter? It matters because if you're trying to determine if you're preventing heart disease and you're 70-something years old, there's a possibility, a very high possibility, that you may already have heart disease and you can't prevent it if you already have it. So there was a major flaw already in the study. Another issue with the study was that they only evaluated one type of hormone replacement therapy, and that was Premarin, which is oral estrogen made from horse equine estrogens out of horse urine, and medroxyprogesterone acetate, which is a progesterone-like hormone, but it's not progesterone. I have to do a little aside here and say, it's really hard to evaluate studies in the literature when they don't really identify what hormones are being used. A lot of them don't even tell you. They just use this word called progestogen or progestin, and they lump all these progesterone-like hormones together. And then they don't necessarily distinguish which type of estrogen women are taking. Is it transdermal? Is it oral? Is it a patch? Is it a cream? Is it estradiol? Is it bioidentical estradiol? Is it conjugated equine estrogens? Or is it fake conjugated estrogens? They actually had an arm of that where they would make estrogens in the lab. They didn't get them naturally from horse urine, but they just made conjugated estrogens that had an estrogen-like effect for women with hot flashes. But with that key in a lock, if you don't have the right shape and it's not bioidentical, it's going to have different side effects. So that's a huge flaw in the study, is that they didn't acknowledge that, and they were not using the safest form of estrogen and progesterone, which we know now very well. It's very important to understand that the root of estrogen matters greatly, because when your ovaries would release estrogen prior to menopause, they didn't release it into your gut. They released it directly into your bloodstream. It would circulate through your body, go to all the receptors that needed it, all the tissues that needed it, and then be metabolized afterwards. Well, when you take a pill, there's something called the first pass effect, which means it goes from your mouth to your intestines, to a blood vessel called the portal vein, to your liver. The problem with oral estrogen, even if it's bioidentical, doesn't matter. Estradiol orally has the same first pass effect as Premarin. And so please don't take oral estrogen. And that is one of the problems with the Women's Health Initiative, is that's what they were using. It was very convenient. They had a pill called PremPro. It had the appropriate amount of Premarin and a small amount of medroxyprogesterone acetate. And it was super easy. A woman would just wake up every morning and take her pill, but it has the negative side effects. Oral estrogen that gets metabolized by the liver increases inflammatory chemicals called cytokines. And that increases your risk of heart attack and stroke. So the Women's Health Initiative was stopped because of a very small increase in breast cancer among hormone users, and because they found that it did not protect against heart disease. Well, you're not using bioidentical estrogen, so maybe the oral estrogen increased heart attack and stroke because of the inflammatory mediators. And then combine that with the fact that the women were 50 to 79 years old, and how many of those women already had heart disease that they didn't know about. And so you can't prevent something that's already there. This is something I ask patients in my practice all the time. The number one killer of women over 50 is heart disease. Do you know what the first symptom of heart disease is? A heart attack. So it's very possible that a lot of the women in the Women's Health Initiative already had pre-existing heart disease, but because it's asymptomatic until you have one of those major cardiac events, you don't know it. 2 years after the Women's Health Initiative was initially halted, another analysis was done where they looked at the estrogen-only arm of the study, and those women had a lower risk of breast cancer than even non-users. It wasn't the estrogen at all. It was the medroxyprogesterone acetate that increased the risk of breast cancer. But you know what? That never made the news. The media had moved on. That's another problem. Women were caught in the dirty laundry phenomenon of the media. The media wants headlines, and they release this massive evening news statement: get off your hormones, it causes breast cancer risk. And then over and over again, more studies and more analyses were done, but it didn't make the mainstream media. And it didn't even really make the mainstream algorithms that doctors were following, because so many women would come to me or another gynecologist looking for a different opinion, being told that either their gynecologist or their primary care doctor told them that they couldn't take hormones. And the data has been out for a long time, looking at reanalysis of the data, looking at bioidentical hormones or estrogen only, and that the studies that came out afterwards did not support that. But it didn't matter because the headline had already happened, the algorithm had been set, black box warning was already placed by the FDA that hormone replacement has a cancer risk. And so people who didn't think outside the box or ask questions just were told no. Let's talk for a minute about what that just told no means. Well, when you think about the conversation that you typically have with your doctor, if you have a 10 to 15 minute appointment, they don't have time to go over risks and benefits and what we know and what we don't know. They're just looking at an algorithm that says, how old is the woman? How long has she been in menopause? Yes or no on the hormones. The ACOG committee opinion until recently has said about the hormone replacement therapy conversation that they encourage OBGYNs to have with their patients, says something like, document that you've told your patient the risks, benefits, and alternatives to hormone replacement therapy, AKA CYA, or cover your ass, so that if something bad happens, nobody could accuse you of not telling them the risks. And then the last statement was some sort of disclaimer of, don't use it longer than 5 years, because that's when the risks start to increase. So for a long time, women who were given hormone replacement therapy were given that scary conversation of quality of life over quantity of life. Like, yes, there's risks and it could shorten your life because of heart disease and breast cancer, but if you want to sleep at night and think straight and get rid of your hot flashes, maybe it's worth the risk. What a horrible choice to have to make. And nobody really thought about asking more questions, or is there a better way to do this? Or should we evaluate the women differently? Can you really lump 50 to 79-year-olds all together in a single group and say that we have enough data to know what's the right thing to do in an individual situation? One of the things that's so crucial in the way I practice medicine is that you're not a number. Your age is a number. You're not a number, and you're not your age. There's 50-year-olds who have the metabolic physiology of a 90-year-old, and there's 75-year-olds who have the metabolic health of a 40-year-old. So you can't just say based on your age that something is right or wrong. You have to have an individualized conversation, but you can't have it in a 5 to 15-minute appointment. Basically, then, anybody who went through residency after 2002 was trained on that philosophy that hormone replacement therapy had major risks and we should do other things. Since that time, they came out with all these alternatives for hot flashes. Layer your clothing, use blood pressure medicine, use antidepressants, anti-seizure medications that may decrease the temperature fluctuations in the body. Well, good grief, it's a hormone deficiency. But they were looking for all these other ways to try to help. I think they meant well, but the reason they were looking at all those other medicines is because of the basic flawed assumption that the hormones were harmful. Thank God, November 10, 2025, the FDA announced that it was removing the black box warning on hormone replacement therapy. Thank goodness that there's a lot of celebrities now who are speaking out about hormones and menopause. And so women are knowing to be able to ask more questions. And I hope over time that the doctors take the time to really read the information behind the algorithms so that they can have these nuanced conversations with patients rather than just following an if then do this algorithm, because you deserve a lot more than that.